This is Tim Bryden, Executive Director of Project Most. We're out on location today for our show. We want to talk to the community a little bit about childhood sports injuries. It's a growing problem in our country because more and more kids are playing sports, and therefore there are more and more injuries. But I think there's things that parents can do to prevent injury in children and younger youth. So we are at the East Hampton Physical Therapy Center in Montauk, and with me is Dr. Rachel Leese, and she's going to facilitate this conversation this morning about childhood sports injuries. Rachel, could you introduce yourself?
Sure. Hi, my name is Dr. Rachel Leese, and this is my new clinic in Montauk that we're at today, like Tim said. I received my master's degree and doctor's degree in physical therapy from Sacred Heart University in Fairfield, Connecticut, and I am currently seeing a lot of small children with sports-related injuries, Tim.
Great, Rachel. And my daughter, Tara, went to Sacred Heart University, so I can attest as to what a great university it is. And she played women's ice hockey, didn't have need for Rachel, thank God. So that's good news. Well, Dr. Leese, let's talk a little bit about, are you seeing more children injured due to sports?
Yes, definitely. Every kind of injury, from things related to your shins and the muscle pulling away from the bone to inflammation of the tendons around the knee, lots and lots of kids' injuries.
Let's talk for a bit about some of the very obvious things parents should be doing right away to prevent sports injuries.
Sure. So as parents, especially working parents, I know that what I'm going to say is easier said than done, but you want to try to get involved from a very early phase in your child's sports season. You need to attend 3 to 5 practices. Make sure that your child's goals, your goals, and the coach's goals are small goals, realistic goals that are setting your athlete up for success. So if everyone is on the same page from the beginning, that will help prevent a lot of injuries.
What do you think, at a minimum, should be some of the things parents should be looking at in terms of equipment?
Sure. So equipment obviously is not top on the priority list in school budgets with tax caps and things that interfere. You want to make sure that all equipment always, even the equipment they're using during a practice, is properly fitting. It's okay if it's hand-me-down and it's been used before,
Right.
but you should not be able to insert more than 2 fingers under a chin strap of any helmet, and you need to check the location by the ear. It should not shift more than 1.5 inches. That would set your child, your athlete, up for a concussion because of an ill-proper fitting helmet. And we're seeing lots of concussions in soccer, gymnastics, and football.
Now, as a physical therapist, could a parent come here and have you check equipment? Is that the role that physical therapists can play?
Yes, absolutely. So physical therapists are the experts in movement dysfunction. So we can help correct any improper movement to prevent an injury. And an improper movement can occur when you have ill-fitting equipment. So definitely.
In terms of children today, what would be some of the major injuries that you're seeing?
Sure. So it does depend on the sport that they're playing.
Right.
Obviously, right now, with it being spring, we're spring training for baseball. So there's lots of rotator cuff injuries in the shoulder muscles and little leaguer's elbow, in not just pitchers, but in catchers as well.
I sometimes hear, when I'm watching professional sports, of course, there is this idea that, you have to win at all costs and therefore you have to play through injury. Do you think that's good advice for children?
Absolutely not. Ways to prevent injury, besides parents getting involved, besides making sure the equipment is fitting, is absolutely do not encourage your athlete, regardless of what sports season it is. If the state championship is tomorrow, you do not want them playing through an injury. You don't want to put that pressure on your child, because then they are going to not only play through an injury, but they're going to constantly practice and practice. And your body needs to be able to rest to heal, to store the energy properly and efficiently in the muscles. If you don't give your body time to rest, it's not if you're going to get injured, but when you're going to get injured.
Okay, so let's talk about some of the acute injuries. What would be an example for a parent to be aware of around acute injury?
Okay, sure. So, anytime a child, an athlete, is complaining of pain in their bones, that should not be occurring. So, there's probably some inflammation or just swelling in that joint, and the parent needs to actually put their hands on the child and say, honey, does this hurt when I touch here? Don't ignore complaints of bone pain when your athlete is expressing them to you, because it could be the beginning signs of an injury from overuse.
What are some of the signs, and sometimes they're very subtle, of head injury?
Sure. So, patients or children athletes can describe symptoms of nausea, loss of appetite, headaches when reading because of some visual disturbances. That can let you know that there could have been a concussion, even a mild concussion, that maybe the child didn't realize the severity of the injury.
Then the second level of injury is the overuse injury. Let's talk a little bit about overuse in children and how does that demonstrate itself?
Sure. So overuse injuries are the most easily preventable injuries. They can be avoided. So it's so important for parents to be mindful of how many pitches your child is throwing in a practice, how often they're going to practices. You need to rest your body in order to prevent overuse injuries, which are your tendonitis and your bursitis. Both of those types of conditions, if not treated early on from a physical therapist or athletic trainer, can lead to a pulled or torn muscle, which require surgery, and you've now lost your whole sports season.
Are you seeing that there is more regulation and caution in childhood sports, or do parents still really need to be very vigilant about overuse?
Parents absolutely need to still stay very vigilant, which is hard to do with your working schedule, um, but it's definitely important.
So the number of games per week, the number of hours per week, the number of training sessions, really parents need to have some awareness.
Yes, they need to be involved, definitely.
Okay. Now, what about the re-injury? What's at stake with that?
Sure. So with re-injury, the biggest risk is permanent deformation of the bone. All children before they hit puberty have growth plates in each and every one of their synovial joints that have not fully fused, which means that depending on the type of stress you place on the bone from your activity, you could impede the growth. You could stunt their growth. You could end up with a 60-year-old that can't move their shoulder or their fingers because of what they did as a 12-year-old baseball player.
Hmm.
So it has permanent effects.
I've often wondered if a parent has a child that has an injury, do they need to have a doctor's prescription for seeking out physical therapy, or could a parent just come here and seek your advice directly?
Sure. So in New York State, we do have direct access. Physical therapists are recognized as the expert in their field, and they can see any child, any patient, for up to 10 visits, as long as the physical therapist who is providing the services has a doctorate degree themselves and has been working full time in the field for a minimum of 3 years. So if you're paying out of pocket, you have access directly and you do not need an MD prescription. Certain insurance companies will still require the prescription. So it does depend on your insurance carrier,
Hmm.
but for the most part, you can come to physical therapy for wellness and preventive medicine.
I mean, here in the East End of Long Island, frankly, we're in a rural area and sometimes it's hard to access a physician quickly. So if you notice that your child has an injury that you think is serious, they can come directly, for example, here to East Hampton Physical Therapy and get a quicker consult with you so that they don't have a child get back engaged into a sport and then do more damage.
Yes, absolutely.
Okay, great. I think it would be great. One of the bigger parts of preparing a child for sports play is the warm up.
Yes, absolutely. So to stay out of injury, you really want a balanced joint. A joint that's healthy and happy has an equal amount of flexibility as it does strength. So we want to stretch, we want to warm up to prevent injuries.
So could we do a demonstration of some things parents can do, independent of coaches or anything like that, to show kids how to properly warm up?
Yeah, sure, absolutely. Great idea. So, Megan, if you'd want to join us now, please.
My name is Megan. I'm from Ireland. I'm a physical therapy aide here with Rachel. I've been working here about a month now, so that's really it.
Great. Okay. So let you take
Okay.
over.
So, Megan was also a collegiate athlete, injured with a concussion while playing soccer, but she's doing great now. We're going to start with some basic stretching routines. The most important thing is to hold your stretches. Stretches should never be done at a rapid pace. They should never be done in a short time frame. 5 minutes is not enough to dedicate to your warm-up if you want to prevent an injury. So we're going to start from the top of your body, your head, and work our way down to your toes. Megan, the first stretch I'd like you to demonstrate is just a cervical rotation. In this position, a parent can encourage their child to gently apply some pressure on the top of their head. And then the opposing arm should go behind your back. This is going to help lengthen your upper trapezius muscle. This can be very tight in sports where you're looking down at the ground, like field hockey, for example. And you want to hold this for a good 20 seconds. Go ahead and repeat it again on the other side. So as the parent, you're going to say, gently apply some pressure on your head. This is the muscle here, and you might even see it stick out of your child's body. That is a sign that they are too tight and need to gain some flexibility in their neck and shoulder, or they will become injured. Great, Megan. Now I'd like you to turn your chin and look over your right shoulder. Good. So this is the other stretch that you should do. No extra pressure from a parent or coach is required. Again, we're warming and loosening up the muscles in our neck. Good. And hold it for 10 to 20 seconds. These are small muscles, but they're very important. Other side, Megan. Good. So you're just looking over as far as you can around your shoulder. Great. Now this next stretch that we're going to do, it involves bringing your hands together behind your back. So one's at the top, you're going to do an apple stretch and turn around so that everyone can see. If you have a proper amount of flexibility in your chest and shoulder, your fingers should be able to connect. So this is an easy test for parents to see if their child is likely to become injured. Go ahead and don't touch your hands. If there's a gap here and the fingers cannot touch, then your child athlete is too limited in their range of motion and they're likely to become injured. Grab your fingers together. So with the upper hand, you're going to be pulling down, and with your bottom hand, you're pulling up. Good. And this is helping to flare open the pec muscles in your chest. You want to hold this for 20 seconds. And do about 5 repetitions of all of these stretches. Good, Megan. You can relax and turn around. Thank you. I know that one feels really nice. So now we're going to help to stretch these core muscles. Your core needs to have a lot of attention. This is where we generate our balance in our body. Do a side bend. So you're going to slide your fingertips down the outer thigh towards your knee. And then with this hand, you're going to reach up over your head as if you're making a shape of a half moon with your body. Again, this is a 20-second hold. And you're always going to repeat these stretches on both sides so that you're balanced and symmetrical. Do one on this side. As a parent, you just want to encourage the proper form. You don't need to apply any extra pressure. So you're really opening up these muscles under the rib cage that help us with our breathing. Yep, keep on breathing. A nice 20-second hold. Good. Okay, now, if you look on the back of everybody's thigh, we have the biggest muscle in our body, our hamstring muscle. And this muscle is where we generate most of our power when we do kicking sports like soccer, or if you're the kicker in football. We want to spend a larger time stretching those larger muscles. So to stretch the hamstring, you just want to bend in half and try to touch your toes to the floor. It's important when you're encouraging your child athlete to stretch that you remind them not to force any of these positions. Again, you don't want to work through an injury. We don't want to cause an injury. So as a guideline, you can tell them that you shouldn't feel any sharp pain. You shouldn't feel any stabbing symptoms when you're in this position. But you'll find that if your child athlete sport requires a lot of running, this muscle will be tight on their body. If this muscle remains tight, they are susceptible to knee and ankle injuries. So, Megan, go ahead and come up about halfway. Parent, a good way to check if your child needs to dedicate more time to stretching is if they reach for the floor and they're not getting to the floor. Then their hamstrings are much, much too tight. Good, Megan. Thank you. Come on up. Now I'd like you to go into a tall kneel pose. So you're going to be knees on the floor. Good. Yep. So in this position, she's going to clasp her hands behind her back and reach towards her heels. So she's flaring open her chest. She's stretching this muscle here, her psoas muscle, which helps control the pelvis, and pulling some quadriceps muscle right here. Go ahead and look up to the ceiling. So as a parent, you want to be the spotter and make sure they don't fall and get injured while they're trying to stretch and stay out of injury. This, again, is a large muscle, so the stretch should be held for at least 20 seconds.
I can feel it.
Good. How does this feel, Megan?
Definitely pulling. It's tight.
Good. Now come up. Good. And now what I want you to do is curl your toes underneath. So we want to stretch the plantar fascia tendon on the bottom of our feet. In many sports, we're wearing shoes like a skate or a cleat that's heavy, and that extra weight can cause injury down in our ankles. So to keep our feet loose, we're curling our toes underneath. Yep, that'd be great. And then you're sitting back. And again, hold that for 10 seconds. Good. And then the last stretch that we want to end with is the child's pose stretch or a prayer stretch. So can you demonstrate that, Megan?
So just leaning back?
Yeah. Sit back. Good. And moms and dads, feel welcome to join your child with all of these stretches because I'm sure we can use it too at the end of a long work day. So this is going to help her neck muscles elongate and all the muscles in her spine. Good, Megan. Thank you. If parents have any questions or concerns about proper stretching and ways to prevent injury, you can always consult the American Academy of Orthopedic Surgeons. They put out guidelines every year that are constantly current with the literature on suggestions to prevent further injury.
Dr. Leese not only is a physical therapist, as you see, but she actually is the owner of East Hampton Physical Therapy. And I was wondering, Dr. Leese, could you comment a little bit about some of the issues for women getting into their own business?
Sure. So I think it's important that women know that they can do it. You shouldn't be misled or intimidated. It is definitely a lengthy, cumbersome process to, secure funds and just to be taken seriously in the workplace. But there's no restrictions why women can't own their own businesses. And I think a woman business owner provides a lot to the community. It's a good example for, children that you can have it all with hard work. And what better example than having your own business?
And Dr. Leese actually is also a parent of children who come to Project Most. Let's say hello to the children.
Hi, Bryden, Brindley, and Bree. Mommy loves you.
Let's talk a little bit about that. What is your perspective about working parents and having a resource like Project Most in this community?
Sure. So I could not do what I do without Project Most. I think our community, as gorgeous as it is also very fortunate to have a program like Project Most. I don't know too many families in this community that can live on one income. And without the extended school day that Project Most provides, I couldn't treat all the patients out there with injuries that need care. So I'm very grateful for the program, and the community is really fortunate to have it.
And to make it complete, Dr. Leese's husband is David Leese, and he's newly elected or appointed to the zoning board of the town of East Hampton, so we'll be seeing a lot of Dave. Let's just wrap up a little bit about what would be again the top 3 or 4 things that you would recommend to parents whose children are now engaging or are very engaged in childhood sports.
Okay, so important things for parents to keep in mind are to get involved with the coach from early on. Make sure that the coach is setting realistic goals for your young athlete. Make sure that they have proper fitting equipment to stay out of injury. And make sure that some of their practice time is dedicated towards gaining flexibility. So, stretching is very important. Oftentimes in sports, the focus becomes on strength. The stronger you are, the more force you'll produce. But you're also more likely to develop a stiffer movement pattern, an unnatural movement that will lead you to injury. You want to make sure that your athlete stays very hydrated, not just in the summer months of their season.
We didn't talk about that, right?
Yeah, that would help
Right.
too.
Always have a bottle of water for
Yep.
training, right?
Always.
Mhm.
So,
Okay. Well, I want to thank you and Megan. Again, we're at East Hampton Physical Therapy. You can come to a physical therapist directly without necessarily a recommendation by a doctor, but we certainly encourage that. But should there be a moment when that's not possible, that you now have information that you can consult with Dr. Lease directly. And we appreciate all this advice on how to protect our children. Childhood sports injuries are on the rise, and we hope the information that we now have provided will be helpful. So thank you very much for watching the Project Mo show, and we look forward to seeing you all again.
It makes me feel like people really care about us.
It's a school within a school. So your kid comes to the Project Most after school.
I'm here helping them so they're not at home struggling by themselves.
I would say that Project Most is a godsend to parents. That it's not just a babysitter for after school. It's education after education, but in a fun way.
You get to do lots of stuff that I bet you don't get to do with your mom and dad at home.
It's not just taking care of us, it's helping us, it's learning. We learn to cook, we learn to swim. It's not just babysitting.
What do you like about Project Most?
I get to play a lot with all my friends, and especially my best friend.
And who's your best friend?
You.
It makes me feel accomplished that I can pass on something that I know that the kids didn't know.
The counselors will help you with your homework if you need help.
It just warms your heart to affect kids of all ages.
When you're having homework, when it's Project Most time, you can do it really easily. And because when you need help and you don't understand something, you can ask like the counselors.
When I walked into Project Most 4 years ago, I didn't know what I wanted to do with the rest of my life. And I started my job here, and I worked with the kids every day, and I just really enjoyed working with them and realized that I wanted to become a teacher.
The counselors would love to help out with kids, teach them new things, and teach them new activities.
I really walked into here just looking for a job to do during school, and I really liked, having the experience of teaching a small group of children. And maybe, I'm thinking about maybe being a music teacher.
I like doing hip-hop, music with Mr. C. I like to do headstands and handstands and I think Adam's cool.
I'm Sean's grandmother, and there's not a lot of children in my neighborhood, so it gives him the socialization after school and time to just be a kid.
And I think Project Most is so special to kids because when you play with your friends, you can also meet their friends, like meet new people.
He's learning to interact differently on different levels with different kids.
We just start doing our homework. Then once we're done with homework, we just talk a lot because other people do homework slowly.
Project Most has taught me how to meet new friends and do be nice to them.
Yeah, like she said, like meet new friends and get to know other people.
As far as socializing, he's a lot better. If he's done something that wasn't acceptable, he's been told why it wasn't acceptable. He's learning that way. It's not just oh, you did this wrong, and that's it. You know, he's told why.
I learned in Project Most kindness and other stuff I haven't known yet. Kindness means to me being nice to people.
It's wonderful how they don't realize that they have an interest, and then thanks to Project Most and the activity that we give them, they realize that, oh, this is really cool.
Well, we like Project Most because we do fun things like cooking and garden club, and we get to do things that we don't usually do in school.
Music, obviously they're singing. A lot of them probably never even danced before, so they're expressing themselves in many different ways.